We have been providing services to North Carolina since 2001. We were one of the first ABA companies to become established in the state.
What's unique about Priorities ABA is that we provide contemporary ABA services.
The ABA that we practice at Priorities is definitely taking a more progressive approach, and it's definitely more modern ABA. It's usually done in a natural setting. It's very play-based. We try to do really child-led therapy. We focus on communication skills, independent living skills, daily living skills, social skills, wherever we can. And the more fun they're having, the more learning that's going to happen.
So we tailor our programs to clients. We make sure that we have a person-centered approach, that programs are socially significant, not only to us, but to families as well. So we really ask the parents, what are some goals that they would like for the client to work on? We make sure that all of our goals are individualized and cater to each individual child.
One way that we stand out as a provider is our connection to a larger network of providers. Our BCBAs have access to very specific groups such as feeding teams. We have advocacy groups across the country to help provide those specific needs for the communities that we serve.
What sets Priorities ABA apart from other providers is not just our longevity in the field of ABA, but our insistence on using the most current research so that our therapy is quality therapy, so that it provides our children and our clients the greatest opportunity for growth.
What makes Priorities stand out from other service providers is the excellent level of training that we provide to all of our technicians, the level of support that we give to our staff, not only to our technicians, but the support that clinicians and the other BCBAs give to each other to make sure, like, hey, is progress being seen across each individual client? If we are not seeing progress, doing a clinical case review, seeing what are some other changes that we can make, maybe getting an outside perspective, working with other service providers, and bringing in other perspectives and feedback wherever we can.
So Priorities takes a more multidisciplinary approach. We want to collaborate with SLPs, speech-language pathologists, OTs, PTs, teachers. If we have grandparents that are in the home or active participants in the child's day-to-day life, we want to make sure that we collaborate with those caregivers.
We do partner with families to make sure that we're providing family treatment guidance, whether it's meeting with parents or other caregivers that are going to be involved in the child's daily life, going through goals and progress that we're seeing, things that we're implementing here that maybe they can be implementing at home, and really working on teaching them the skills that we would be teaching our technicians as well.
So that we are all on the same page and we can provide that person-centered care for the child and for the family.
So a little bit of encouragement for those first-time diagnosed families is we have experience doing this. A lot of our clinicians here at Priorities and across all of Learn have multiple years in the field, and we have research that backs up what we're doing and how it is effective for the individuals.
For families that are just starting on that journey of looking for ABA services and trying to find a center that they can go to, they should really focus on making sure that they find a learning center that's going to be a good fit for them, match the values that they have, is going to be able to work with them, and is going to be able to work with the time and availability that they have.
So there's so many things that I love about working with this company. My favorite part is seeing the growth of all of our clients. Whether it's a small achievement or something huge, it's hard to explain that feeling.
You're not in this work for anything other than seeing the progress and the amazing things these children can do. It's no matter how small the milestone or the progress is progress.
This service matters because we are making meaningful changes in these children and also family as a whole lives.
And seeing that we helped make that impact along with the staff and the families, it's a group effort. And the fact that we all worked collaboratively to get this child where they are, it means the world.